Oh, good news, guys. We finally got an endpoint for this pandemic. Yeah. Reporter asked Biden while he was getting his booster shot, because you remember what was that like last week? No, it was at the end, a couple weeks ago at this point. All the dates kind of just run together at this point, but the CDC, they got together in their dark rooms with their fucking black robes on. They held their little vote saying that, oh yeah, booster shots aren't really all that necessary for anybody over the age of 65. And then the New York Times had their report that for anybody over that age, you get an additional 12 days worth of coverage, I guess. And then after that, it just kind of falls off of a fucking cliff. So I guess Biden's up for another, a week and a half. He's going to be all sudden done. But I guess he was lucid enough to answer one question that was fucking screamed at him. The only thing we're going to need to get back to normal, or at least the United States. Canada's fucked. We're never going to come back to normal, and so are you guys, obviously. 97 to 98%. I think we'll get awful close, but I'm not the scientist, obviously. I think one thing is for certain. A quarter of the country can't go unvaccinated, and us not continue to have a problem. It's only going to be a problem for literally ever, because you guys just keep changing the definition. Herd immunity for shit like this is normally, around 80% of people have some kind of a coverage, but you guys aren't concerned with natural immunity or anything of the sort. No, it's 100% of people get the 97 to 98% of people get the fucking poke, and then continue to get the poke, okay? And you can already see it, right? Because he's already said, a bunch of people can go out and get the booster shot whenever they want it, right? And then, 97 to 9, because that's fucking realistic to get virtually 100% of people fucking jabbed up. So let's just say, okay, let's just go ahead and expand upon this, okay? Let's say they get to 97, 98%, okay? Is that of people who have got the initial two pokes, okay? Or the one if you have the Johnson & Johnson? I can't say what I'm thinking. Yeah, if they get all of that, but then it's a couple of people who are in that range where they qualify to get the booster jab but haven't quite yet, so we can't quite return to normal until everybody's got the booster. And then it's that constant cycle of cyclical going to and fro the pharmacy to continue to get your fucking jab. Like, is that the future? Is that the return to normal that we're all looking for? Or are we just gonna have to fucking live with this? Like, even ABC has finally got around to the point that everybody had some 15, 16 months ago. Yeah. We'll just read a little bit of this. It's not really terribly important. In the early days of the pandemic, experts kept a close watch on the number of new cases. Yeah, actually, no, they were much more concerned with the people who were dying, and then magically, once those numbers started to not be quite as alarming as they were in the beginning, then they started to report on, new cases, and the percentage of people who are in the hospital, and whoops, don't do any further digging in that. One of the key metrics signaling success or failure of the public health measures. Oh, okay, obviously, yes, because we've had great success throughout human history of controlling virus spread and transmission control. Right. But with new variants leading to more frequent breakthrough infections, you can just say that without having to cite your source. Cool. Mild COVID-19 cases will likely still persist. No shit. Even if a person in the country is fully vaccinated. Holy fuck, imagine that. Even before any vaccines were authorized, we knew this was going to be an issue. Dr. Lynn Goldman, Dean of George Washington University's Milken Institute of Public Health. No shit. No vaccine is 100% effective and preventing infection. No, but we need to get 97 to 98%. Oh, okay, cool, because that's the only way we can fight it, right? Added Dr. Kimberly Fisher. Why are you only asking women doctors? I don't get it. Anyways, professor of medicine. Oh, that's why, because they all control the institutions. That's why. Medicine at University of Massachusetts Chan Medical School. Now, public health and infectious disease experts are shifting their metric to success. We're going to have to live with it. Wow! The vaccine still highly protective against severe illness. Oh, no, the vaccine is supposed to stop it cold dead in its tracks. Now, all of a sudden, it's a symptom mitigator? Wow! Cool. I'm glad you guys have finally caught up. Experts said we should focus less on cases and instead how many people are being hospitalized or dying. You don't want to do that, because then people will start to question the whole pandemic certification, and you won't be able to shill your new drugs because there's a Oral drug. We reported on this one. Oh my gosh, that's got to be like a month ago at this point when Pfizer was going through all of their shit. Yeah, now they're sending it to trial again. It doesn't do anything different. It's just once again another symptom mitigator. Okay, it's going to be something else that if the 97% of people get all jabbed up, make sure that you're now on the pill as well. And we don't know what the fuck that's going to do because, oh, don't worry, we're going to be thoroughly studying it with a 2,660. You should have just finished it off and had an additional 6 people show up for it anyways. Healthy adult participants aged 18 and older who live in the same household as an individual with a confirmed symptomatic COVID-19 infection. Yeah, if... you know what, you've been jabbed up and somebody else in your house manages to get sick and you want to have even more protection with the safe and effective vaccine that's already coursing through your system, you can go ahead and hop on this fucking pill once it'll eventually get fucking certified anyways. They're going through trials and all that shit. It's going to be super effective. But what's the government's response to all of this stuff? Well, Biden, because remember, according to very organic pinned Twitter threads, and pinned trending topics, there's legal precedent in Biden's vaccine mandate for the private sector, obviously, right? Yeah, it's so all-encompassing and totally on the up and up that Biden's encouraging smaller businesses now to have vaccine mandates and install a fucking vaccine passport system. It's so good and it's so honest and it's so true, right? Obviously. President Biden on September 27th received a Pfizer COVID-19 booster dose on camera and answered a couple of pre-approved questions. Boosters are important, but the most important thing we need to do is get more people vaccinated. Yeah, sure, whatever. The president said he's moving forward with vaccination requirements wherever he can and urged businesses to establish their own vaccine mandates. Why? It at least gives the appearance that he's doing something, I guess, about something that mainstream media has brainwashed all the public into thinking is such a big, overwhelming health crisis. Don't you know the bed shortages that's in the hospitals and the places and the things and people are dying and like 50% of people think that if you catch the coof, you're going to end up in hospital. If you guys watched, I forget which video that was from a couple days ago. We went through that. Oh, it was Australia. Australia being a tyrannical police state. Second half of that video. Yeah. The misinformation war is clearly on. On Wednesday, I'll be traveling to Chicago. Hopefully you bring a bulletproof vest along with your booster shot to talk about why it's so important that more businesses are instituting their own vaccine requirements, he said before getting the booster. Why? Okay, can you elaborate on that? Oh, no, he can't. It's getting pretty late in the day when he did this. I think it was before noon. He's already been up for like 2 hours. What can you expect from this old fuck? A few weeks ago, Biden announced that he would issue an order directing, OSHA, to enforce a rule requiring workers at businesses with over 100 employees. But that's not good enough for Joe. It needs to be small businesses. Any of the ones that are still surviving, they should institute vaccine passports that will effectively kill them off and put them, back into those 100-plus employee businesses. But you know what? With that $3.2 trillion budget that's going through, and they're having a bitch of a time trying to force it through as well with all of their egregious spending and all of the additional pork that's just stuffed into that fucking bill, they're going to have to try to keep government open in order to try to work this through in order to fund government, right? It's been funded. They passed an emergency bill in order for them to still get their paychecks. They're going to be open until, I'm pretty sure it's the end of the month or the end of October, right? Regardless, they're not going to miss another paycheck, but anybody who doesn't get jabbed up, you can still lose your job. But hey, don't worry about that. The people who are in charge, they are never, ever, ever going to miss a payment. Because if they did, they wouldn't be around to force these rules, right? And that could hurt the fight against COVID-19. And it would also hurt mandates. Stop encouraging us. The White House on Monday warned that the looming government shutdown could hurt the Biden administration's COVID-19 mandates. Who's fucking scared by this? Like, do they not understand that this is what a significant portion of the population actually wants? Like, you're trying to say, oh no, we're gonna miss out on this if you guys if we don't get this budget passed. And those evil Republicans, especially that one from West Virginia, Joe Manchin, if he doesn't want to pass his budget, we're not gonna have any authority to enforce our tyrannical mandates. What the fuck is wrong with you people? Congress has until the end of September to pass legislation to avert a shutdown, as Republicans and Democrats have struggled to come to an agreement on a number of measures. Government shutdowns, which generally don't last longer than a month, can cause a disruption of the federal government's programs and services. Not limited to closing down national parks and institutions, some Defense Department programs, and programs that are funded by law rather than annual appropriation acts. As a result, some public health measures, yes, which are all being enforced under emergency authorization, would be affected by this. Oh no, we shouldn't allow them to, go without funding. That would be a horrible, horrible fucking test scenario to see if the American people can actually function better without the government. I would just wonder what the fuck would happen. It's never a good thing for the government to shut down. It's happened under literally every single presidency with like 2 fucking notable examples. It happens. It happens every fucking time. I think Clinton was the only one to not shut down in modern times. And that's why we're doing everything to prevent that from happening, Psaki said in response to a question. We'll have more for her in the second video of the day. Number of public health operations would continue in the midst of the shutdown, she said, saying that most of the public health work would be exempted from the government shutdown. It's great. They'd be forced to shut down, but they can still tell you how to run. Yeah, cool. Government for and by the people, right? Remember that little line? I'm sure that got ripped off somewhere along the way. But that doesn't change the fact that we're having having service shutdowns, staff cuts, and different agencies is not an interest in addressing any crisis we face, including a pandemic. Well, you could always just end the pandemic and you can just let more people, go back and live their life. But it looks like you aren't going to have to really worry about laying off staff, because they're starting to rise up because they don't want to fucking play along with your stupid vaccine mandates. Because we got 3 examples, okay? 3 notable examples here to just wrap everything up. So, first and foremost, I know that this is just a little bit off the beaten trail because we've been talking all about Joe and his fucking mandates, but up here in Canada, and especially in Alberta, we went from free to lockdown harder than just about everybody else in the fucking world over the course of a week, and there's a significant portion of healthcare workers already fighting against the forced vaccination requirements of healthcare workers. We're only going to read just a little bit of this open letter, but it is important. This open letter is in response to your announcement of mandatory full vaccinations for all AHS staff by October 31st, 2021. We represent a wide range of vaccinated and unvaccinated healthcare professionals from multiple disciplines who are deeply concerned about these mandatory vaccinations. There are many reasons that we stand against a mandatory vaccination and highlight some of them below as a concern and are supported by peer-reviewed publications and statements from established organizations. Things I can't read, even though, you guys can. And of course, if you want to do any further digging, description, link, all the normal shit. The overall survival rate of COVID is approximately 99.7% and varies by age and underlying health status. Yeah. The vaccine is showing weakened efficacy after only a few months. Yes, AHS's own data shows Alberta Health Services, okay, just for clarification. Current approximately 25% of new cases are in fully vaccinated patients, and over 18% of hospitalizations are also fully vaccinated, with percentages increasing as weeks go by. Imagine that. United Kingdom and Israel, 2 highly vaccinated countries, 2 of the highest. Israel, I think, is the highest, and the United Kingdom is in the top 5, if I'm not mistaken, have extremely high percentages of hospitalized patients being fully vaccinated. Indeed, the Israeli Public Health Department recently estimated the efficacy of the Pfizer vaccine had fallen to 39% against the Delta variant, and another recent study from the Mayo Clinic, you've probably heard of them before, had similar numbers at 42%, okay? We believe that the proposed vaccine mandate is contrary to Section 2 of the Charter of Rights and Freedoms, Canadian Constitution, freedom of conscience and religion, and in Section 7, the right to life, liberty, and the security of the person, and the right not to be deprived thereof, except in accordance with the principles of fundamental justice. I would consider that as well, and I think it's a good case as any. And we've also talked about this before in the past couple of weeks, but there's been multiple frontline healthcare worker walkouts in front of many different hospitals and clinics as well, protesting the stuff that is written down here, but it's nice to see a coordinated effort, at least within the boundaries of Alberta. And here's actually what we're dealing with. There's no need for any kind of sound on this, but this is our top doctor here. Okay, listen. So she put hand sanitizer on her hands in order to take off her mask, and then sanitizes her hands again. Like, what is she also fucking wipe her box with that fucking mask, or like what the fuck is she doing? Okay, and then as everything is wrapping up, she just literally stood at the fucking podium and delivered her message, sanitized her hands again because I guess paper's filthy, to put on her mask, and then this is what we're fucking dealing with here. And then the bitch just fucking stayed right, doesn't have a mask on at all. We're dealing with fucking theater up here. Like Viva Fry points out, yeah, Dina Hinshaw, that's the name of the doctor, and they always have fucking goofy names, is psychotic. No shit. No fucking shit, okay? And there's also a very interesting signed affidavit, okay? And this is just, one Army doctor writing, Aerospace medicine specialist Teresa Long calls on Pentagon to ground all pilots that have taken COVID shots. She has very interesting and fairly based in science, okay, I would consider them based overall takes as to why people experiencing significant G-forces should be grounded, but obviously, because YouTube's a free and open marketplace of ideas, we could discuss this further on other outlets, but just for brevity's sake, of course, attach the description as to who Dr. Teresa Long is, and then also her affidavit. Don't mind the Captain Marvel Brie Larson picture. I don't know why that's there, but that was on the deep capture, and that's got all of the affidavit there. It's a long boy, and she has a lot of really, really good credentials and little points as well. So hey, if you're interested in a disagreeing opinion to what the mainstream narrative at least was, it seems to be shifting at least very, very slowly right now, but we're coming. And then there's more experts that are starting to finally wake up and marshal their forces, because there's a lot of people from different corners that are out there, right, who think that all of these tyrannical mandates and enforcements and passport systems are just not something that can coexist with the free world. They are in fact antithetical to Western values. And now, in a more marshaled force, 3,000 doctors and scientists signed declaration accusing COVID policymakers of crimes against humanity. Where's the lie? Where's the lie? This is the article we're going to wrap up on. A physician's declaration produced by an international alliance of physicians and medical scientists strongly condemned the global strategy to treat COVID, accusing policymakers of potential crimes against humanity for preventing physicians from providing life-saving treatments for their patients and suppressing open scientific discussions. I love it. I love it! The document states that one-size-fits-all treatment recommendations have resulted in needless illness and death. As of 1 p.m. Friday afternoon, this previous Friday, the declaration had garnered over 3,100 signatures from doctors and scientists around the world. A group of physicians and scientists met in Rome, Italy earlier in the month for a 3-day global COVID summit to speak truth to power about COVID pandemic research and treatment. The summit, which was held from September 12th to September 14th, gave the medical professionals an opportunity to compare studies and assess the efficacy of the various treatments that have been developed in hospitals, doctors' offices, and research labs throughout the world. The document, reprinted below in its entirety, we won't go through all of it, of course, sprang from the conference. The physician's declaration was first read at the Rome COVID Summit, catalyzing an explosion of active support from medical scientists and physicians around the globe. Now, these professionals are not expecting career threats, character assassinations, papers, and research censored. Oh, we're not, sorry. Obviously, yeah. The social accounts blocked. Yep. Search results manipulated, clinical trials, and patent observations banned, and their professional history and accomplishments altered or omitted in academic and mainstream media. Dr. Robert Malone, architect of the mRNA vaccine platform, read the Rome Declaration at the summit. Thousands have died from COVID as a result of being denied life-saving early treatment. Yup. The declaration is a battle cry from physicians who are daily fighting in their right to treat their patients and the right of patients to receive those treatments without fear of interference, retribution, or censorship by the government, pharmacies, pharmaceutical corporations, and big tech. Where's the lie? Where's the lie? We demand that these groups step aside and honor the sanctity and integrity of patient-physician relationships, a fundamental maxim of first, do no harm, and the freedom of patients and physicians to make informed medical decisions. Lives depend on it. But yeah, if Joe Rogan wants to take experimental treatments in order to get over the virus and produce a negative test not but 3 days after his first positive, if he has the right to do that, and other people also have the opportunity to access those same treatments, we wouldn't have a pandemic on our hands anymore, people. Obviously. But if you want to go through the rest of these articles, which obviously for very obvious reasons we can't go through in more detail, but I agree with most of them, to be completely honest. Obviously, the experts' fucking opinions on this stuff. The guy who developed the fucking mRNA vaccine, for Christ's sakes, he has a take on this, but what? He's too spicy for most mainstream media outlets? Go fuck yourself. So you can see what the actual experts are starting to say. And then Biden's pie-in-the-sky dream of 97-98%, because guess what, guys? He loves power more than he loves seeing a school bus pull up in front of his house at the end of the day. And he does love that. But next we got a hodgepodge of very interesting developments that happened over the weekend as well. This one's exclusively coof stuff because all of that stuff was just kind of fermenting as well, and it didn't quite fit with, some more audit developments and then the big budget itself. So let's talk about that next. Thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.